once again, good to know that you're still there with us on this Wednesday morning, where we are here to discuss another topical issue on Midweek Connect. Remember, I am still Ifeoma Okafor. This edition is will be very interesting and educative, where we are going to bring to the fore the talking about Johesu strike that been on strike since last year, talking about the joint health sector workers. Within this Johesu, you have pharmacists, you have nurses, you have physiotherapists, excluding medical doctors that have their own union, the NMA, Nigerian Medical Association. So they've been on strike since that last year, and this year 2026 they are continuing, even when the federal government has quickly intervened in the NMA, that's Medical Doctors Association, and Johesu are now being left behind. So this morning we are going to discuss the effects, the challenges this causing to citizens, especially when you consider the high rate of medical care in private hospitals. Though we don't have anybody coming from that association, but we'll have an analyst in the studio that will make justice to what we are discussing this morning. He is Barrister Greg Iyayi. He's a regular on this program. Welcome, Barrister.
Happy New Year, first of all.
It's a true Happy New Year, by the way. Happy New Year. We've not seen this year, but we've spoken on the phone.
Of course.
Happy New Year. You're welcome. You're welcome, sir.
And Happy New Year and good morning, viewers.
Thank you, Barrister, for always coming whenever we call upon you. So, how do you see this issue of Johesu strike, especially when federal government, the NMA, threatened to go on strike, and the federal government quickly intervened, and the Johesu being so, because when you talk about nurses, talk about pharmacies and physiotherapists, don't you think they are also very important when it concerns health care system?
Yes. Everyone down the line is very important, particularly when you talk of health. We are here today because we are healthy. If we were ill, we wouldn't be here. So health comes first, and that is why anytime any of the sectors in the health sector, any union in the health sector embark on strike, it is very disturbing, because just like you rightly mentioned in the intro, the cost of Medicare in the private sector is very expensive, and many Nigerians cannot afford it. So they rely very much on the healthcare from the public institutions, and we are really disturbed, because this has been on since last year, like you rightly said, and you can just imagine the effects on healthcare delivery in every hospital across the land. So I think it's high time that the two sides, they get together, because when two elephants fight, it's the grass that suffer, and the public, we are the grass. So the two elephants, I think it's high time they come together, and then they have mercy on the masses, so that the masses can have the affordable Medicare.
Okay, so since this is the 5th year now, that is, it started from 2021, that the technical committee on discrimination against any category of health workers, don't you think is 5 years is damn too much for the government not to look into, because they're looking at it as being discriminatory? So how do you see it?
You see, in the health sector, the doctor is always the name that comes to mind first, but there is little or nothing the doctor can do in the hospital without the other professionals, whether it's the person in the lab, whether it's the person in the dispensary, everywhere. But the government always appears to give more attention to the medical doctors, and I think that is what is really escalating issues. The government should know that the medical doctors cannot do any healthcare delivery without the other health professionals. And if they are making a demand and they are asking for something, 5 years is more than enough, to settle down and actually deal with this issue decisively. So,
okay, in your own take, Barrister, do you believe there is actually a discrimination between this Johesu and NMA?
Yes, I do believe.
Why do you have to say
you should pay for work done, not name born.
Okay, work done, not name born.
Yes.
Okay.
There are some people in the healthcare delivery system that might even be working more than doctors. We can say that very, very authoritatively. Go to the hospital, you will see what goes on, and I think they should be rewarded. At least their remuneration should be according to the work they are doing, not the name they are bearing. Because I'm not a doctor, even if I work more than a doctor, or I do some things more strategic, without which the doctor actually cannot work, then I should not be deprived of commensurate remuneration. This is where the problem is jinxed. And the government should, make sure that that jinx is removed. Pay people according to the work that they are doing. And there are professionals within the government, very qualified professionals, that can guide the government on how to actually pay these people so that there will be harmony in the health sector. Because if there is no harmony in the health sector, we're in problem, honestly. We're in very, very serious problem, because we cannot outsource everybody our health care. Everybody cannot go to India, everybody cannot go to UK, everyone cannot go to the Western countries.
Okay.
So the government should deal with this issue very decisively.
Okay, do you think maybe because the NMA, Nigerian Medical Association, they are always eager for government to look into their problem, they're always on the news, they are always they avoid always amplifying their voices when it has to do with their welfare? Do you think maybe Johesu, pharmacies and other sectors, workers under healthcare, the joint healthcare, yes, do you think they are not, maybe the association is not amplifying their voice more as NMA is doing? That's the reason why, whenever the doctors threaten for strike, government will want to wage in. But when it comes to that's what people are alleging.
Yes, you see, if a child does not cry very loudly, that does not mean what that child demands should not be given to him or her. There are some unions that are more vociferous and very aggressive in their demands, but there are other unions that tend to be very civil, very mild, and they sometimes we tend wrongly to ignore them, and when they are making their demands we feel that we can do without them. But actually a doctor will even tell you that there's little or nothing he or she can do if the other health professionals are not in the hospital. Yes, the doctor might be the head of the hospital, but he cannot work without the other people. So I think the government should not allow people to cry, too loud before their heart or their problems are seen to. That is where Johesu, I think, has said, okay, if it's that we are not crying loud enough, let us cry, continue to cry. Since last year, they have been crying. And if you actually look at it, maybe the doctors were the one crying since last year.
Okay.
But yeah, the government would have come in.
They even threatened before you knew it. The government just came to their rescue, and there was a round table dialogue, and it was resolved.
Yes.
So that's the issue. And so your own take is that they should cry harder and louder.
Yes, and the government should not allow that kind of situation. The government should be proactive. The government should actually see if the word orderly in the hospital is very important. The cleaners, very, very important. So, and there's little or nothing. The doctor doesn't give injection.
Okay.
Yes, the nurses do. The doctor is not a laboratory scientist. And before the doctor treats, he will tell you, go and do this test. It is based on the result of the test that they can now prescribe. It will give a prescription. And then the person that is the pharmacist is the one who will give the medicine. So please, the government should be proactive and then listen to these people, even if they are not crying as loud as other people. The healthcare delivery system will be grounded, seriously grounded,
especially federal
health institutions will be grounded if these people are not there. And I think they have cried loud enough, and the government should actually come and do what they are supposed to do. Because if you look at since the COVID, people have realized the importance of healthcare workers. And you can see that every country is trying as much as possible to hold together the healthcare system. And I know the government is not negligent, but I think they should do more than what they are doing, so that our healthcare system will not fall apart. Because you see the mass exodus of healthcare workers from the country.
Okay, talking about brain drain.
Brain drain. These are people, some of them were trained in government institutions. They have gathered the experience. Why should we export them?
Okay, so we'll come back to this brain drain as a factor in healthcare delivery system in Nigeria. When we'll call our number to call, it's interactive phoning program where you are a viewer, you're expected to call to make your contributions, your opinion, or even give advice to the stakeholders, the government, and whoever that is involved, to stop these lingering strike actions by our healthcare sectors. You can call the number 081 090 42594. 081 090 42594. You can send text message, WhatsApp message on that number to be a part of what we're discussing this morning. So, Barrister, let's come to the effects of this, to brain drain, talking about healthcare workers, migrating, the high exodus of them to other parts of the country, and how it affects healthcare delivery in Nigeria.
It's very, very devastating, honestly.
Excuse me.
Because if you look at our healthcare system and medical tourism, and then the brain drain, yes, you hear that the best surgeons, the best doctors, the best healthcare workers in many countries, they are Nigerians. And you begin to wonder, a lot of our government officials, Aisha Buhari said something one day. He said the scanning machine in Aso Rock Clinic, she wanted to do a scan, it was not working.
Really? Yeah.
And the next thing he just heard is that some of our aides were saying, let's book a flight so that you can go to this and go and do it in London and come back tomorrow morning. But only to find out that across the roads, Nasoro, there was a clinic.
A private clinic.
A private clinic.
Okay.
That she could go to, and she went there and she did the scan. Indeed, the medical director of Asoro Clinic was there. He said, thank God you are here. I know the amount that was actually budgeted for Asoro Clinic. And he said, I would prefer a clinic that is well equipped and well staffed under a tent than all these building construction. He said that is just contracts. He said the real healthcare delivery is not there. He said, I am the wife of the president, and if this can happen to me, I just wonder what will happen to other junior workers that are in Asoro. So I think we should be very serious about it. Otherwise, our healthcare workers will continue to go away from the country. And these people, they take time to train. It's not what you can just go to New Benin Market and buy another one and replace. Okay. They take time. They have gathered the experience that even somebody who is trained and graduates today may not have. Some of them have been on the job for a long time, and they're going to share and use this experience in other lands.
Okay, so meaning that they're not migrating to get further education. They are already trained. It's just for them to go and start work somewhere.
Just to go and start work somewhere. I mean, the training they might be giving there is just orientation. Some of them are already qualified. They have international professional certificates from Nigeria here.
Okay.
But they just go away, and we are really losing a lot, honestly.
Okay, so talking about the high rate of, you talked about the former first lady,
yes,
going to, because of the lack of equipment, now had to go to a clinic,
yes,
opposite the place that she went to. So how do you see the exorbitant rate of medical treatment in these private hospitals? Maybe because she's well to do, that was why she was able to afford payment. So how do you see the high rate? Is it maybe that was the reason some people are now saying maybe that's the reason why private hospitals are very expensive, because they know these federal hospitals are on
definitely. It's like the universities. Many of them are very expensive. They know that the public universities sometimes crisis shuts down, and then people now prefer, okay, even if I will pay more, let my child go there. I'm sure when my child enters, I'm sure when he will graduate. And many private universities are cashing in on that. So also in the health sector. So I think if the public health institutions are actually functioning properly, people will prefer to go there. Because let me tell you, in a good hospital, private hospital, you might have 2-3 doctors. Unlike a public health institution where you have departments, you have specialists, you have experienced people. Some of these people have been on the job for decades. So they have gathered experience. And when they are not working, what you may get in the private sector is actually more attention, and then perhaps better equipment. Not necessarily that the health personnel are better. Sometimes you might even discover that the health personnel who are on strike in public health institutions, they are the ones working there or part-time. Honestly. And the price is just what the ordinary person cannot afford. And I think it's really unfair to the average Nigerians to leave them at the mercy of private health institutions that they cannot afford. And when they cannot afford it, what happens?
Okay, some people are even frowning at the activities of these private hospitals or private medical centers that you go, that they don't have, they still have beautiful structures, then equipments, but they don't have the wherewithal to now manage or operate those medical equipments.
There's no private hospital that would be better than a well-run public hospital. That is the truth.
Okay.
And that is just the truth. It's just that maybe, as you said, they might have better structures, they might have better equipment. But when it comes to the medical personnel, the government medical institutions are better because they are well structured, they are well trained, then they have experience. They are not like these people who just come from.
Okay, they have all these things. Sorry, the barrister. They have all these things, and people are pushed. Sick people and their relatives are pushed to, access Medicare in those private hospitals. What's your take on that? Yes, public hospitals are, are personnel. In terms of personnel, they might not have the equipments, and that's why we are now advocating for it. But you see the situation whereby they don't have option, especially during strike actions like this. They are now pushed to, access Medicare in the private hospitals because they don't have any option. They don't have alternatives.
They don't have alternative, and at very high cost. Some of them borrow money. Some of them borrow on exorbitant interest rates just to make somebody live. And that is someone that at an average cost in public medical facility, would have survived and would have gotten very good treatment. There is nothing that really says that the private sector we give better treatment. You saw what happened to Chimamanda's son.
Chimamanda Adichie, the renowned writer,
the internationally acclaimed writer. So what happened, and it's something that is very distressing. That should tell us that the private, the public hospital should be fixed by the government. Government should give them attention, because some of our government's officials, they've been abroad. They have seen how things are there, and some of the things done there, they are doable here. They are very, very doable. Okay. And then they should give serious attention to it. And I also want to plead with the personnel, particularly the doctors in the public hospitals. Please pay for work. Do the work that you are paid for, and give adequate attention.
Yes.
Because
humanity to also play out.
There should be some bit of compassion, because, to be candid, the government will do its best, but the medical personnel may not give their best, and it is very sad, and it discourages the government. Because this thing is both sides. It discourages the government that after making sacrifice to make things work for the Nigerians, and then you just see some of them, they give more attention, or they might even divert the patients to the private clinics where they have interest. This is not fair.
Okay. I just want us to also talk about this. Probably that's the reason people migrate. You see people, the surge in all this traditional medicine. I saw some of them. You see, when you see the environment, the method, and then nobody supervises what they do, the concussion that they give to people will now snowball into another complication. So how do you see that, sir?
Well, I'm not a critic of traditional medicine, but I hold a healthy suspicion, because some of their methods, their drugs, are not subjected to scientific tests. It's one person that decides, and you see one drug, it will cure malaria, it will cure backache, it will cure this, it will cure that, it will cure that. Isn't it a wonder drug? And I think the government should regulate and supervise, because we are talking about life. We are talking about life. And if the life goes, it's not replaceable. So the government should do their best and regulate traditional medicine. I'm not saying that there are no herbs that might be able to give a succor to people that are ill. But again, you cannot blame Nigerians where they cannot have, where the public health institutions are not working. And they do not have enough to go to the private medical care. I mean, whatever, some of them just fall victim and they go there. If somehow they'll be able to get some relief or something, and whatever they just see, they take, and the effect on them might be positive, it may also not be positive. But it is difficult sometimes to blame them, despite the fact that you want to make them aware of the danger. The issue is, where do they go and what do they do? When all roads are closed, and this is the only one, it's fairly affordable, but they are not sure of it.
The effectiveness of it.
The effectiveness of it. And it's not subjected to any scientific tests.
Okay.
You know, when people were talking of Abalaka in medicine in those days, what was the issue? The enemy said, okay, if we are able to find a cure for AIDS locally, that would be a medical feat that we will celebrate worldwide. But let us subject your medicine to scientific tests. He refused.
Okay.
He was just saying that they are jealous, they are this, they are that, and so on. And that was how the issue went.
Okay, there was a time I did a report on I think either malaria, cancer, or whatnot, and I was interviewing a doctor from a teaching hospital, and his complaint was that they have, in fact, they are strained. People, besiege the teaching hospital. When you have just malaria, you come to a teaching hospital instead of going to a primary health care, or the teaching hospital is a tertiary institution where whatever case they're treating is mostly on referral.
Yes.
But you see somebody that is that misses a woman, that misses her period, coming to a teaching hospital. So when you come there, you see, many people, many sick people, that is also a strain on them.
Yes.
When you want to start complaining about this having negative effects, psychological effects on them, the medical doctors and other medical personnel. So how do you see this issue of the primary healthcare center not being operational the way it used to be? Because in medicine or medical care, they have primary health care, they have secondary, they then now have tertiary. Just like the doctor mentioned, that it's for referral. When it has to be a very complicated issue, that is when you now come there, so that a team of professionals will look into the case. But you see somebody having just headache coming to a teaching hospital. So how do you see it?
It is very sad, and I think that people have to be enlightened, and also you see, government at all levels ought to enlighten what are our councillors doing.
Okay.
Because will I blaming the governor, will I blaming the federal government? Our local government chairmen, what are they doing? Do they make sure that in their constituencies, the primary health care center is one well equipped, well staffed, and that it is really functional? Otherwise, people will know if what they need is available let's say at a primary health care center, there is one. Why would they go all the way to UBTH or even to Central Hospital if it's available there? And there's supposed to be a doctor in a primary health care center, and there's some experienced nurses and other health personnel. If they are there, it's nearer to them. But if they go there and they cannot see a qualified health personnel, the drugs or the equipment are not there, and then the thing is not even functional. So what do they do? So this is one of the reasons you see pressure coming on the teaching hospitals. So it is very, it is very, very sad. And I think if you look at Benin now, we are talking of Stella Obasanjo for the state,
yes,
and then the Central Hospital. Now, if you look at Benin, in those days when these hospitals were first built, and the population now, I think the population now, because we have to take cognizance of the population. So the population is exploding, and I think the government should also plan for the people as the population grows, and then decentralize some of these hospitals or build standard hospitals in various locations. Why should the Bubahil, the entire Bubahil, not have a government hospital?
A primary health center.
No primary health center. If you look at the population of Bubahil,
that's this Aduawa, Ikobahil,
Aduawa, if you are talking of Aduawa, then talk of the neighboring villages.
Enya.
Then you are talking of Okeze, you are talking of Ohwahe, Aduhaha, and then some of the other villages around, Uzala and Ute. So if you are talking of all those, if you know the population,
okay, to have a secondary
medical center
at the center,
yes,
okay, so that all these villages around
can come, because if you look at the population of all these places and what the population of Benin was in those days, you find that even Central Hospital cannot meet the need, or Stella Obasanjo alone. And Stella Obasanjo is supposed to be a specialized hospital for children and women. But we now see that it's like a general hospital for everybody. And even the one that is in on that golf course road area, in those days it was actually for just
I think it's for
sickle cell. It was for sickle cell, because I once lived.
It's still sickle cell. It's still for sickle cell now.
But if you go there and you see the population there, I begin to wonder whether it's even for sickle cell. I once lived in 3rd Avenue.
Okay.
They used to call it then Ogbe Nursing Home.
Okay.
That Ogbe Nursing Home, you just see a few people, but just go there now and you see how the place is.
Okay, meaning that people are looking for help.
They are looking for help, and you find sometimes the doctors and medical staff, they are overworked. They are really overworked. What that doctor told you is true. So then the fatigue, and then you see the law of diminishing returns. You know, it's not only in the market, it's also in human capital. That the more the person works, the less he will actually give. So out of fatigue, you see some of the doctors, some of them even sometimes break down. Because the doctor is a human being. The nurse is a human being.
Yes, pharmacists, the lab scientists, and all of them.
Exactly.
So we'll still talk about this. They probably, if you go to some primary healthcare facilities, you hardly see a medical doctor, and at the end of the day, that same medical doctor is also under a union
going on strike, pressing on government for this, that, compensation for that one and that one. So how do you see it? Because you talked about, at least if you're doing anything, you should also, apart from being dedicated to your duty, also have to lace it with humanity.
Exactly.
So how do you see it? Because they are also part of these members, the unions that always press the government for. But you go to these primary healthcare centers, you hardly see, so as people always complain.
I agree with you. Almost all the primary healthcare centers, I can say that it's only few of the doctors that are there the days they are supposed to be there and the time they are supposed to be there. And how many of them stay till the time they are supposed to close? You see, I feel that the government should be, yes, it's not a charity profession, but the doctors are also supposed to be humane. That humanity, that compassion for the people is supposed to be there. If you are a doctor and you are paid to be in the primary healthcare center and you are not there and you are taking the salary and you are shouting for increment, it's unfair and very, very unpatriotic. And I think the government should go after such doctors. And even NMA should have an internal mechanism of educating these people and then dealing with them if they are erring, because they give a bad name to the NMA. And the medical profession is a noble profession. It's not for charlatans. I mean, if you don't like it, don't do it. If you don't want the job, then go elsewhere. But to take the job and not do it is unethical, and it's against the oath that you took as a doctor. And if you said because the salary is small, then quit the job. Somebody else may accept that salary and we do the job as it's supposed to be done.
Okay, talking about the joint health sector unions now, the pharmacists, the nurses, the laboratory scientists, the technologists, the physiotherapists, they work as a team. They are like help to medical doctors. And people are of the opinion that the NMA must and should also raise their voice for these sister sectors that help them to achieve their objectives. That's why are they keeping quiet when this set of medical personnel are on strike since last year, and government is meeting on their needs and talking about doctors, and when it comes to this, it now look as if they are discriminatory on their own part. So that why are they keeping quiet? Why are they not speaking up on their behalf?
And that they are self-centered.
You say they are self-centered. The medical doctors.
And it will look.
Okay, to look okay.
As if they are self-centered. So I agree with you. Knowing that you cannot work without these people, and that you're going to the hospital and receiving salary and doing, I would say, skeletal work, because you cannot go to the lab and do the work. You can't do the work of the nurses, physiotherapists, and so on. You should also make the government realize that, look, please answer these are companions. Without them, we cannot work. Even if you have met our needs and we are okay with that, also see to their own. For instance, when some judges were to have been appointed, because we saw that many of our judges, they were stressed. The enemy, we cried out.
The NBA.
The NBA, we cried out.
Nigerian Bar Association.
Because we know that the judges cannot come out because of their coups. They cannot come out. We cried out on their behalf. Because we can shout, we can, we are
demonstrate.
Like the street fighters.
And
we fought on their behalf. And when this government came to power, those judges that NJC had already approved, I mean, they were sworn in, and that decongested some of the courts. So that is how it should be, because we know that if cases are piled up and we don't have enough judges, it will also affect us too.
Okay, so generally, what's your closing remark? We just have a 1 minute to close.
My closing remark is that please, the government should know that health is wealth. And if you are talking about the productivity of the population, there can be no productivity without good health. A healthy nation is a wealthy nation. So do well to please listen to Johesu, and then at least make them realize what you can give, and give to them and appeal to them to take that, and then let work in our hospitals go on.
Okay, thank you so much for coming and your insights in this discussion on the Johesu strike. And yes, thank you for your time, Barrister Greg Iyayi. And your viewer out there, also thank you for your time. Yes, health is wealth, and a healthy nation is a wealthy nation. And Johesu, just like NMA and every other health sector, also very important when it comes to health delivery system in Nigeria. And just like Barrister Iyayi has said, and appeal to the government to look into their matter and end this lingering strike action that is affecting the health sector and the personal and also citizens of Nigeria. So thank you for giving us your time, and we hope to see you next week when we come with another interesting topic. Since till then, have a nice day. Bye.